For this occupational therapy portfolio topic, I'm going to be running through goniometry. So first I want to note the difference between active range of motion and passive range of motion. Active range of motion is your client actually performing the action by themselves, whereas passive is you doing the motion for them. So I'm going to be measuring my patient's active range of motion, and when I would measure passive range of motion would be that if my client wasn't able to get full range of motion actively, but for this I'm just going to measure active range of motion, and if she's not able to get there, then I will do passive. So first I'm going to start with the neck. First I'm going to do cervical flexion, so I'm going to go ahead and line this up here with your chin. And what I want you to do is I want you to go ahead and bring your chin down to your chest. Okay, great job. We got about 46 degrees. Okay, and now for extension, go ahead and just go right back to normal there. Again, lined up with your chin there. And what I want you to do is I want you to bring your head back as if you're looking up at the sky. And again, we're going to go ahead, and that's about 44 degrees, and 45 is normal, so I'm just going to see if I can get just a little bit more. Okay, fantastic. So that was cervical flexion and extension. Next, I'm going to do lateral flexion. So I'm going to find my patient's spinous process. There we go. Or the spinous process of C7. And I'm going to go ahead and line up the stationary arm with my patient's shoulder. Okay, so go ahead and bring your right ear to your right shoulder. Okay, so we got about 42. I'm just going to see if I can take you just a little more passively. Fantastic. Okay. Now I'm going to go ahead and do the same on the left side. So find her C7 again. Stationary arm out to the side. I'm going to start at a 90-degree angle, but technically starting at 0. So what I want you to do is go ahead and bring your left ear to your left shoulder. Okay. And 45 degrees. Great. So again, that was cervical lateral flexion on both sides. Now what I'm going to do is test my patient's cervical rotation. So I'm going to have the stationary arm out toward the back and my movement arm out toward the front, lined up with her nose. So I just want to make sure I'm in a position where I can line it up with her nose. So I've got the fulcrum at the top of the head. Okay, so now what I want you to do is go ahead and turn your chin over to your right shoulder. Okay, so we've got about 41 degrees. I'm just going to see if I can't bring you a little bit further. Fantastic. Okay, now for the other side. Again, lining up with the nose. Go ahead and rotate over to your other shoulder. And great, we've got about 49 degrees of rotation to her left. So this is goniometry of the neck. Now I'm doing goniometry of the shoulder. So first we're going to do shoulder flexion. I'm gonna put my fulcrum on the tip of her shoulder here, and I've got the stationary arm lined up with her body. So what I want you to do is I want you to bring your hand up in front of you and reach toward the sky. Go ahead. Okay, and my patient's reaching about 169. Great. Okay, now come back down, and I'm going to do the same thing for shoulder extension. And what I want you to do is just reach your arm back behind you, okay? Whenever you're ready. Okay, and we are getting 70 on shoulder extension. Okay, now we're going to do shoulder abduction. So I'm going to put my fulcrum on the back of her shoulder here, and I've got the stationary arm lined up with the body. And what I want you to do is I want you to bring your arm out to the side, reach up toward the sky as high as you can whenever you're ready. Fantastic, okay. And up there, we're reaching 168. Great job. Okay, now we're going to do shoulder external and internal rotation. So first I'll do external rotation. What I want you to do is I want you to bring your arm here to 90 degrees and 90 degrees of elbow flexion. And I'm going to line my fulcrum up here with the tip of her elbow. And what I want you to do from this position is I want you to bring your hand, rotate your hand up toward the sky, just like that. I'm actually going to start, sorry, my apologies. I have my stationary arm lined up with her forearm. And again, I'm going to have you rotate your hand up toward the ceiling whenever you're ready. Okay, and we're getting 85 for external rotation. And for this one, what I'm going to have you do is rotate your hand down toward the floor whenever you're ready. And for this one, I'm getting 66, so I'm going to go ahead and see if I can just bring you a little bit further. Great, okay, so that was shoulder external rotation and internal rotation. And lastly, what I'm going to do is horizontal abduction and adduction. So we'll do horizontal adduction first. So I'm going to have you bring your arm out here. I'm going to place my fulcrum up on the tip of her shoulder. Stationary arm is parallel in line with her body. And what I'm going to have you do is I'm going to have you bring your arm out in front of you, keeping it straight and as far over as you can bring it, okay? Okay, so my patient's able to get 126 for horizontal adduction. I'm going to see if I can push you a little bit further. Okay, now that's getting us to about 130. Now, similar starting position for horizontal abduction. I'm going to have my patient with her arm out here. I'm going to stand in front of her so I'm not in the way of her arm. Fulcrum up on the tip of the shoulder, stationary arm in line with the body. For this one, what I'm going to have you do is from here, I'm going to have you reach backward, keeping your arm at the same level. Go ahead whenever you're ready. Okay, and my patient is reaching 44 degrees of horizontal abduction. And this is goniometry of the shoulder. Now I'm going to do range of motion measurements with the goniometer for the elbow. So for the elbow, we have extension and flexion. So what I'm going to do is I'm going to line up my axis with my patient's olecranon. Okay, now I'm going to and I have my stationary arm in line with her humerus, your upper arm. So I'm going to start, we're going to start in as extended as you can. There we go. Okay, so we're at 0 for extension, which is great. And now what I want you to do is I want you to bring your hand to your mouth as far as you can, whenever you're ready. Okay, and my patient is getting to 159. Typically I would get my patient to, or the average range of motion for elbow flexion is 170. However, I can see that my patient's arm is as far as it's gonna go. There's no way for me to passively push her any further. So my patient's elbow extension to flexion is 0 to 159. Now I'm going to do goniometry of the wrist. So first I'm going to start out doing radial and ulnar deviation. So I'm going to have my stationary arm up the line with the forearm, and I'm gonna have my fulcrum right above her wrist. And I am going to line up my movement arm with her middle MCP joint. And what I'm gonna have you do first is I'm gonna have you bring your thumb over to the side, over by your wrist, as far as you can. Okay, and so for radial deviation, I got 22. And now for this one, for ulnar deviation, I'm gonna have you do the same, but with your pinky. Okay, and for this one, we're getting 35, and I want to make sure that when I'm doing this, I'm lining it up with the third knuckle, because the fingers sometimes will go further, but that doesn't necessarily mean the wrist is going further. So now I'm going to do flexion and extension of the wrist. So I'm going to have you have your hand on the side just like that, and I'm going to put my stationary up aligned with her forearm. Again, the fulcrum I'm going to have over her radial styloid, and I'm going to be aligning my movement arm with her index finger. So whenever you're ready, go ahead and just bend your wrist forward into flexion as far as you can. Okay, for wrist flexion, I'm getting about 83, 85 degrees. Okay, and now we're going to come back to the middle here, because we're gonna do the same thing, but this time I'm gonna have you bring your hand back for extension of the wrist. So go ahead and do that. Fantastic. Okay, and for that, I'm getting about 65 degrees. So I'm gonna go ahead and see if I can bring you passively a little further. Fantastic, and I brought her passively to 70 degrees. So this is range of motion of the wrist. Now I'm gonna do goniometry measurements of the fingers. I'm gonna start first with the MCP joint, and we're gonna start off with flexion and extension of the MCP joint. So I'm gonna actually put my fulcrum over top of that MCP joint, and I've got my movement arm in line with her first finger and my stationary arm down the hand and into the wrist. So what I want you to do is I just want you to flex your fingers like so. Okay. Okay, and she's getting to 90 degrees for MCP flexion, which is good, that's normal. And then we're gonna go back to this neutral position here, and for this one, what I want you to do is I want you to extend your fingers backward. Okay, great, and again, I'm just following this first finger, and we're getting to 50 degrees, which is good. Normal is 0 to 45 for MCP extension. And now I'm going to do PIP, which is this middle joint here of the finger. So I have essentially just moved my fulcrum up to the PIP joint. And what I want you to do is just bend your finger like so. Great. Okay, and I'm getting 110 for PIP flexion. So now I'm gonna do flexion of the DIP joint, which is this furthest joint of your finger here. So what I'm gonna do is I'm going to place my fulcrum on the DIP, but when she bends her finger, I'm gonna have to have my stationary arm actually in line with her middle phalange of the finger. So go ahead and bend your finger just like we did for the PIP. Okay, great. So that's why I now have my stationary in line with her middle phalange. And again, my fulcrum's on the DIP. I'm gonna go ahead and measure. I'm gonna stand up to get a better view. Fantastic, we're getting about 79 degrees of DIP flexion. And this is goniometer measurements of the MCP, the PIP, and the DIP joints. Now we're gonna do goniometry measurements of the pivots of the thumb, including palmar abduction, radial abduction, flexion of the MCP joint, and flexion of the IP joint. So first we're gonna start off with flexion of the MCP joint. So what I'm gonna do is I'm lining up my stationary arm in line with the wrist, and I've got my fulcrum on the MCP joint, and I'm actually gonna have you turn your hand a little bit for me because this is kind of long. When you go to flex, I would hit the table and it would give me an incorrect reading. So go ahead and just flex your thumb like so. Okay. Okay, I'm getting 55 degrees for MCP flexion, which is good because MCP flexion is usually 0 to 50. Okay, now I'm going to measure PIP flexion, so you can go ahead and relax for a second there. Okay, now go ahead and give me that movement back. I'm gonna place my fulcrum on the IP joint, my stationary arm in line with the first or the proximal phalange of the thumb. And now I'm gonna line up my movement arm with the distal phalange of the thumb. And we're getting 90 degrees, which is normal for IP flexion of the thumb. So now I'm gonna have your hand up just like this. And this time I'm going to do palmar abduction. So I'm gonna have my fulcrum on the anatomical snuff box of the thumb, my stationary arm in line with the wrist. And what I'm gonna have you do is I'm gonna have you bring your thumb out like you're gonna hold a can. Okay, just like that. Okay, and I'm getting 50 degrees for palmar abduction, which is normal. And now I'm gonna place your hand down flat on the table like this because we're going to do radial abduction. I'm going to put my fulcrum over my patient's anatomical snuff box. My stationary arm is in line with the wrist, and my movement arm is going to follow her thumb. So what I want you to do is I just want you to bring your thumb, slide it across the table out toward your wrist as far as you can. Okay, and again for radial abduction of the thumb, I'm getting 50 degrees, which is normal as well. A couple things to add about goniometry is the way that I know sometimes what I need to do goniometry measurements on is by starting with a functional screen or just observing my patient and being able to note when there are limitations. Another thing to add is that for the shoulder, I did not measure adduction only because I was able to see that my patient was able to get her arms straight at her side. However, sometimes you may have a patient who might have a shoulder contraction where their arm is here and they're not able to get full adduction. So if that were the case, I would take that measurement to note whether they're starting at 0 or not for shoulder adduction to abduction. And the last thing that I want to measure is I showed you how to do these measurements just on one side of the body. However, you may find it necessary to do bilateral measurements to get an idea of what their baseline should be for that joint.